You're watching the award-winning GHS TV, a nationally recognized student television station.
Hello, and welcome to this week's edition of GHS TV's award-winning talk show, Crosstalk. I'm your host, Jamaia Chase. Each week in this time slot, we take a look at different issues, personalities, and events that affect you and our community. With the 2019 school year just beginning, young scholars around Memphis are entering the next chapter of their lives by heading to college. In this episode, we are taking a closer look at some of Memphis's state-of-the-art medical program trainings, the next generation of doctors and specialists. Our first spotlight is the Southern College of Optometry, which has spent nearly 90 years graduating some of the best clinicians in the field. Here's a look at their program. Here with me now to go more in depth about what the Southern College of Optometry offers is the Student Services and Admissions Officer, Rebecca Griffin-Smetana. Ms. Smetana, thank you so much for joining us today.
Thank you for having me. It's a real pleasure to be here. I appreciate the opportunity.
Southern College of Optometry is known for providing students with the practical knowledge they need to succeed. Can you tell us about your program?
I would be happy to. So I represent Southern College of Optometry, and we are a single-purpose optometry school. So everyone at the school, the faculty, the staff, and students are all in it for the field of optometry. And what optometry is the primary healthcare provider for your sense of vision, for your eye health. And so our students have the goal of becoming a doctor of optometry by completing the 4-year program that we offer in the Memphis Medical District at our campus.
Can you walk us through your admissions process?
Absolutely. So we recruit students who have finished some undergraduate studies. So we start working with students as early as high school and through their undergraduate career to talk to them about what the field of optometry could offer them, some of the benefits of pursuing the career and so forth. So that by the time that they finish at least 3 years of undergrad studies at a university or college level, most of them have done or have intentions of completing their bachelor's degree. They're going to start working on the application process. So they submit an application online. We work with them every step of the way. They have to have completed some prerequisite courses. So we're often asked, what do I need to major in as an undergraduate student? And if you're thinking about college ahead of you, you might be thinking about, okay, I want to get to this career, so what degree is going to lead me there? Well, in our case for optometry, there's not a specific degree that we really want to see out of our students. We like well-roundedness. We like students who follow their passions. A lot of our students are interested in science, so that leads them to a degree in that sort of field, so maybe biology or chemistry or physics, but we have a certain set list of prerequisite courses that our students need to take to cover the basic information that they need to succeed in the program. So taking those prerequisite courses are really important. Those start from the first year of undergrad studies, so starting to work on things like chemistry, biology. We have some math classes, but we like, again, well-roundedness, so we want to see some English classes, social studies, etc. So prerequisite courses are a really important thing that leads up to the application that they submit. There's also an entrance exam called the optometry admissions test that students need to take as they're working on the application, but otherwise we help them through all the nitty-gritty of the application, and after they graduate with their bachelor's degree, they're ready to enroll maybe even the following fall semester in our program.
Well, who can apply and how many students get accepted on average?
It's a great question. So we accept applications from anybody. We want to recruit the best students no matter where they're from, what their background is. We want to get a lot of different diverse perspectives to our program, to our campus. So we like students who are interested in helping people. That's the real nature of the career of optometry, is helping others. We like students who are interested in the healthcare field. And we ultimately try to recruit about 130 students each year. So it's a 4-year program, 130 students each year, so we have about 530 or so students in our program in a given time.
Tell us about your endowed scholarship. How did it get started?
Sure. So we're really proud of the endowment that we have available at our school, which is largely due to the really generous alumni that we have graduating from Southern College of Optometry. So the people who have been through the program, who have graduated, who have started practicing as optometrists, and they do pretty well, so they decide to donate some money back to the school to help students to get the next group of optometrists in the profession. So we give away between 50 and 60 scholarships to students every year coming through our program, and they can be up to $20,000 per student per year, so some pretty significant funds that we can give to our students to help subsidize their education, which is largely due to the really generous alumni that we have graduating at SCO.
Can you talk about the hands-on experience students gain at SCO?
I would love to. So we really pride ourselves in offering a very clinically focused education program. We want it to be really hands-on. So we want our students to be able to start working with equipment, learning how to do relevant procedures in the program in day one. And so they do just that. They're in your lecture style courses where you have a professor teaching you, but they get into a lab environment in the first day of the program and start working with equipment and practicing on one another. And then they also do a lot of care in our clinical environment. So we operate a few different eye care centers, and our students actually work in those eye care centers and care for patients. They start shadowing in the second year, but then in their third year, they're spending a lot of hours in those eye care facilities actually caring for patients. So that the final 2 years of the program, the third and the fourth year, they're seeing a lot of patients. They actually see anywhere between around 2,500 and 3,000 patients by the time that they graduate the program, which is pretty significant.
What kind of techniques do you use when teaching students about eye care?
Great. So it's just that. It's really getting the students in front of patients so that they can take what they've learned in the classroom and apply that when they are caring for a patient. So like I said, it's a combination of lecture style courses, so being taught about the basic sciences behind your vision, behind your ocular health and your health in general, and then working on the different equipment. So you might be familiar with refraction. I see you wear a pair of glasses there, so going in to see your optometrist to see what your prescription is. so that you can see a little bit better, but it goes beyond just getting glasses and getting your contact prescriptions. So it's about taking care of your eyes and taking care of your entire health too. So optometrists see different things when they look into your eyes. They can see your blood vessels, they can see different conditions, systemic conditions that patients have. So they're diagnosing a lot of different things, tumors even, just by looking into your eyes. So it's often said that your eyes are kind of the window to the rest of your body and the window to your health. And so it's really important that patients go and see optometrists once a year, not only to get an updated prescription if they wear glasses or contact lenses, but to see what else is going on in their health in general. So our students use a lot of different pieces of technology, a lot of different procedures to do just that, to look at the different things related to your vision and your eye health to diagnose what's going on in your body with your health.
Well, we have some student testimonials we'd like to show. Let's take a look.
That sounds great.
Optometry is the coolest thing to me. I love being here. I love helping people.
I chose optometry because it's real people-oriented. You get a lot of patient interaction. Plus, I'm just a real nerd about eyes.
I really felt that optometry gave me that really nice patient-doctor relationship and something that I could grow into.
SEO was the perfect bundle because I loved it from the moment I walked in, and they gave me a scholarship that sealed the deal for me. And immediately in my head, I was like, I'm going to SEO.
I decided on SEO because the clinical experience that you get here is second to none. We have the largest eye clinic in North America, which is really cool. The staff doctor to student ratio in the clinic is 4-to-1, so you get a lot of personal, in-depth experience with the clinic.
I think it is beneficial that our faculty here have optometric degrees, because when they are teaching us materials, they can code it in such a way that we can use that in our future optometric careers.
They don't just try to rush you through things and hope that you get it, and if you don't, pass that practical or something, they don't just say, oh, well, hopefully they'll learn it later. They want to make sure that you're going to hit that checkpoint.
I feel like SEO is preparing me well for pediatric optometry. We've learned a lot about how the eyes work together when you're developing, and I feel like as I progress throughout the curriculum, we're going to get even further into optometry involving pediatrics.
I was not just a number here. I was a name, I was a person. So I felt really welcome here, and that's a lot of the reason why I chose SEO.
There's plenty of help everywhere I look for it, and I feel like every professor and doctor and student is here to help each other, and so I think that's what has made SEO very good for me.
My experience at SEO has been amazing. It's been a blink of an eye. Honestly, I'm going to be a third year in a couple weeks, and I just don't know where the time has gone. I've learned so much, and I've made such good friends here, and I just can't wait to see where the rest of these 2 years will take me and my future career beyond that.
Ms. Mitana, thank you so much for speaking with us today.
Thank you so much for having me.
For more information about the Southern College of Optometry, visit their website at sco.edu. Now, we have to take a short break, but when we come back, we'll hear from a nationally recognized program located right here in Memphis.
GHS TV started in 1982, and it was just a couple of cameras, a couple of on-air personality, and it's really grown into what you see today. It's a multi-million-dollar studio with top-of-the-line technology.
Being able to operate, all of the machinery in the control room, being able to use all of our software and hardware that we have around the studio is a great skill, because this is top-of-the-line equipment.
I feel like this class has brightened my horizon. It's something that I never thought I would be doing, especially as a student.
GHS TV is probably one of the most hands-on experiences a student will ever get in their lifetime.
Welcome back to Crosstalk. Nothing really has just the vibe that we have here.
Especially after you finish, you get a real rush of, wow, I just did that.
By the time a student graduates from Germantown High School, they will know pretty much every position there is, from producing to directing to on-air work.
You learn time management, you learn organization, you learn how to work with people, how to better communicate with people.
We put a lot on them, and they have to be able to have the responsibility and the knowledge to get everything that we ask them.
I had very little experience, so in the past 3 years, the skills that I've learned have absolutely exponentially grown.
The class has actually helped me figure out that I want to go to college for journalism.
When a student graduates, they are the best possible version of themselves that they can be.
Thanks for tuning in. We'll see you tomorrow.
For more information about the Kappa program, visit ghskappa.com or call 755-7775. You're watching the award-winning GHS TV, a nationally recognized student television station.
Welcome back to Crosstalk. I'm Jamaia Chase. We're moving on to another top-of-the-line school that offers a little bit for everybody. The Southwest Tennessee Community College was created from a merger between the former Shelby State Community College and the State Technical Institute at Memphis. Since then, it has been ranked in the top 100 associate degree producer for total minorities in business operations. Here's an inside look at what all Southwest has to offer.
Good afternoon, future Salukis. On behalf of Southwest,
I chose Southwest to find my path,
to train for my career,
to achieve my dreams. Put him on a non-rebreather of 15 liters a minute.
To transform my life.
Southwest is your best choice. Enroll today.
The Allied Health Sciences program at STCC incorporates a multitude of skills and subjects that fully prepare students to be versatile in the medical field after graduation. I'm here now with Dr. Osborne Burks, head of the Allied Health Sciences Department, and Dr. Melvin Wilborn, who specializes in Southwest Nursing Program. Dr. Burke and Dr. Wilborn, thank you both for being here today.
Thank you for having us, Jamaia.
Thank you so much.
Dr. Burke,
yes,
I went over what your program was about in the introduction. Can you tell us more about it?
Well, I can say this. Now is exciting times to be at Southwest because the Department of Allied Health, as well as Nursing and Natural Sciences, we are laser focused on producing people for the job market. And we have several programs. We have the Radiology Technology program, that's a degree program. We have the Physical Therapist Assistant program that is also degreed. And we have the Medical Laboratory Technician program, that's another degree program, followed with 3 or 4 other certificate programs, depends upon how you meet them. If we call it EMT, Emergency Medical Technology program, along with the paramedics, we count that as one program, but you advance to the next one. That one's a certificate program. The Pharmacy Technician program is a certificate program as well. And we have the Laboratory Phlebotomy program is also a certificate program.
Well, you have a very competitive program. What kind of students are admitted?
Well, we get mostly high school students from all ages. But, you know, once high school, and then we get some who want to come back to school. So we get from various ages. It's multicultural program. We're open access. So all our schools and all of our students come from all over the community.
Dr. Wilborn, you have an outstanding nursing program. Can you describe it?
Yes, our program offers an Associate of Applied Science degree. We have two tracks. We have the generic track and the LPN mobility track. The LPN track offers students who are already practicing LPNs to come and pursue their RN degree. Our generic track program allows students who have no nursing background to come in and pursue their RN degree. And on the horizon, we also, for January 2020, we plan to start our paramedic to RN program as well.
What makes your nursing program stand out from the rest?
What makes our nursing program stand out for the rest is that we focus on success. We want to make sure that our students are prepared to go out in the field and practice as professional nurses. So we make sure that we try to have small class sizes. We make sure that we try to have make sure we teach students to be inquisitive about their learning, so they won't just be task-oriented. We want to make sure that they are able to go on. We try to make sure they are prepared and encourage them to go on to seek higher degrees, to get their bachelor's degree, get their master's degree, and also come back and serve at Southwest or in the community. That's our goal, is to make sure that we prepare our students to go out and play an active role in the community.
Well, what are some of the classes that nursing students take?
Some classes that nursing students take in the nursing program is a special admissions program. So we do have, you don't have to have any prereqs to enter the program. You can come in, but we are indexed. That's one of the things. We do use an indexing system. But in the nursing program, we have foundations, which is the foundational class that everybody takes as they come in. We have dosages and solutions, which is a math course that teaches the student how to give medications and the importance of giving the right dose at the right time to the right patient. We also have our adult health course. We have a mental health, which I currently teach in the mental health course, didactic and clinical. We have pediatrics. We have our OB course, which is our obstetrics and gynecology course that we have for our students. So that's in the program. We cover all areas of nursing to make sure that our students can get out and perform as a novice professional nurse.
Dr. Burke, what about health science classes?
Well, it depends upon what particular program you're speaking of. For example, if you're in pharmacy, you'll take the Intro to Pharmacy Operations. You take pharmacology and therapeutics. You would take seminar. If you're in basic EMT, you would take all of those classes that will propel one to become a first responder. And then from there, you would advance to the basic, and you go to advanced to ultimately lead you to becoming a paramedic. And that's the individual who ultimately is the ER on the mobile ER. So when something happens and they're in direct contact with physicians to make sure you get the best care. So it depends upon which particular program you're speaking of.
Can you talk about the hands-on experience students gain from your program?
Oh, yes, ma'am. Yes, I can. We have all of our programs first are accredited, nationally accredited programs, which means that we must provide what we call interns, sometimes externships, and then sometimes they call clinicals to each one of our participants. As she says in her nursing programs, we do that with the basic EMT, we do it with the paramedics, we do it with the pharmacy technicians, we do it with the physical therapist assistants, we do it with the radiologic technologists. So all of our programs require the hands-on experiences.
Can you talk about hands-on in your nursing program, Dr. Wilborn?
Sure. Hands-on our nursing program, part of our program that we must have a clinical component to each one of our courses. So, for example, in mental health, as I teach mental health, we go to some of the mental health areas, facilities in the area. We also do some community service awareness projects for the students to do some service learning. All of ours are hands-on. We have to go into the clinical setting. So we go into the hospitals, we go into the nursing homes, we go into other facilities so to make sure that our students are actually practicing what we are teaching them. We can talk about it in the classroom, but we have to make sure that our students are able to perform these skills when they go into the professional role as a nurse.
Dr. Burke, can you tell us about some of the types of degrees and certificates that students can receive?
Well, yes. There's an Associate of Applied Science. There's for certificates, for degrees. Then there's the certification in basic EMT, certification in advanced, certification in paramedics, certification in pharmacy technician. Those are our certificates. And then our degree programs, depending upon which area, for example, if it's a medical laboratory technician, those are 2-year degrees. And so those are associate degrees.
Why do you think that health sciences are so important today?
Well, I'll tell you, because truthfully, baby boomers are getting older. We're getting older. And we were a large part of the population. So the demand is there, and Southwest is willing to meet that demand. We're here to meet that demand. All of our programs are, like I said, nationally accredited, but we are also sought after. And because we have a great reputation for producing great allied healthcare professionals.
Dr. Wilborn, can you talk about the nursing program as it relates to why it's so important?
Why is it so important? Nursing is, again, as I piggyback on him, it's a need for nursing. There's a great shortage of nurses. So we are eager to make sure we can close the gap somewhat in that demand. So we are we are accredited by ASIN, which means we have exceeded the bar. You know, our governing body is the Tennessee Board of Regents. So they say that, you know, you don't have to be accredited to be a nursing program, but being accredited means that we have set this, you know, we have set this bar, and we have met that bar. That would mean we have set the bar for the quality of nursing, to prepare quality nursing students. So we want to make sure that we can close the gap by continuing to provide excellent educational opportunities for our students, especially students in the community, and by increasing the availability of students to be able to come into our program, and constantly changing how we teach, constantly being able to modify that, and just make sure that we're doing our part to kind of reach the job market, you know, make sure that we are reaching the job market, and making sure we are doing the things that we need to do for that need.
What can students receive from graduating from Southwest, Dr. Burke?
What do you mean in terms of, well, I guess you mean general. Besides their degree, they'll get the satisfaction of knowing that they came from an institution that is laser focused on their success. We do everything to prepare our students. As I told you earlier, our students are sought after in the medical areas. In fact, in other areas too. We go we expand the gamut. We have 7 different locations for students to matriculate. But what you can mostly receive is the satisfaction of knowing that you came from obtained a quality education. That's what you can. And we work hard, the both of us and everyone else there at Southwest. That's what we do every day. We come to make sure that we prepare our students, because we know that they are representing us. And we want them to do that, and we want them to do that quite well.
Well, Dr. Burke and Dr. Wilborn, thank you both so much for being here with us today.
Thank you for having us. We appreciate you. Appreciate the opportunity.
Visit southwest.tn.edu/Allied Health if you would like to learn more about the Allied Health Sciences or the nursing program. I hope you enjoyed this episode, and will continue to explore other top-notch colleges around the Memphis area. Remember, Crosstalk can be seen each week at 9:30 a.m. and 7 p.m. on Mondays and Thursdays, Tuesdays and Thursdays at 2 a.m. and 12 p.m. and 7 p.m. on Sundays. For more information on our programming, please check us out on the web at ghstv.org, where we are streaming live 24 hours a day. You can also check us out on Facebook and Twitter. I'm Jamaia Chase. From all of us at GHS TV, thank you for watching Crosstalk, and I hope to see you again.